Indiana appears to be making some progress on limiting the spread of COVID-19. Check out the latest metrics map from the state health department. It shows 8 counties at the highest risk for community spread. That's the same number as 1 week ago. Those are the counties in red. 7 fewer counties are in orange this week. That is the next highest level. 15 counties are in yellow and no counties are in blue, which is the lowest level. State health officials report 1,708 Hoosiers are hospitalized with the virus. That is a level closer to what we saw around mid-August. Well, the FDA says that it has not reached a conclusion on when to allow Johnson & Johnson booster doses to be administered. Agency scientists posted a review of the booster shot online today. They say Johnson & Johnson gave them little information on how the shot protects against the Delta variant. The FDA approved the Pfizer booster to be given 6 months after the dose. Moderna is requesting the same, but Johnson & Johnson is proposing a second shot anywhere between 2 and 6 months. An FDA advisory panel is set to discuss the J&J and Moderna boosters tomorrow and Friday.
Sierra, thank you very much. Let's go ahead and welcome in Wish TV medical expert and former Surgeon General Dr. Jerome Adams. Dr. Adams, thanks for joining us live and in person today.
Good to be here with you, and you're back from Baltimore.
Yes, back from Baltimore, right into the thick of things. Which means let's go ahead and get into it.
Indeed.
When it comes to what you're expecting to hear from the FDA advisory panel this week, what's on your mind? What are you expecting?
Well, you know, it's good news right now. It's good news because cases are starting to come down, as you just heard. It's good news because hospitalizations are leveling off, and we're hoping that we'll start to see deaths start to come down. But we've got to stay vigilant. And part of being vigilant is making sure we can get boosters and that we go out and get them when they're available. And the FDA will be deciding tomorrow and then the next 2 days on boosters for Johnson & Johnson and for Moderna. And I actually expect that they will approve a booster shot for both of them, because we know they've already approved booster shots for Pfizer based on waning immunity. But what's interesting is on the Johnson & Johnson, the question is whether or not they will approve them to get boosters from other vaccines, because they'll be asking that question too. A heterologous boosting is what we call it. And for Moderna, it's a half dose, which will maybe provide people with fewer side effects when they get boosted.
You know, I'm glad that you went right into that, because that is what a lot of people are asking, diversifying those booster shots. What's the effects of those, what's not? And I guess that will be a part of that conversation?
Absolutely. It will be a part of the conversation, and we're seeing multiple studies coming out now saying that not only is it okay to mix and match shots, but that you may get better immunity if you mix and match shots. So I'm hopeful that the FDA will give us some guidance there, will actually allow people to do that. I'm not as optimistic that they will, because the data is not as compelling as saying, and it's not as easy, quite frankly, as the FDA just saying you can boost with the same shot. But public health officials like myself, it's something that we're hoping that we'll see.
I saw you having this conversation, and I thought it was a good one for us to have here as well when it comes to side effects of getting the vaccine, and where, you know, when people have other medications, how that plays a part as well. A lot of people still asking, what are the long-term side effects of getting the vaccine?
Well, you know, and it's important for people to understand that when we look at the history of vaccines go into your body, they boost your immune response, and then they go away. So we almost always see any side effects within 6 to 8 weeks when you give someone a vaccine. They don't pop up 6 months, a year, 2 years later. And we now have over a year of data for all of these vaccines, which is why we believe they're incredibly safe. But the other thing people need to know is your choice right now is a choice between the virus and the vaccine. And no matter how much you're fearful of a vaccine, trust me, the studies are clear that it is much worse to be exposed to COVID than it is to be exposed to a vaccine. So I hope people out there who are still hesitant, I hope you'll go out and get your vaccination. I hope if you have questions, you'll ask your doctor or pharmacist or nurse or someone who's trusted.
You know, let's switch gears a little bit. We saw the headlines about Texas Governor Greg Abbott on Monday issuing an executive order cracking down really on COVID-19 vaccine mandates, this time banning any entity in the state of Texas, including private businesses, from requiring vaccinations for employees or customers. If other states see this and try to do the same thing, where do you see where the U.S. will be health-wise? Because the vaccine mandates have been top of mind for many people.
Well, politics and health don't play well together. From a pure health perspective, vaccine mandates are effective at improving population health and extending lives. It's clear. There's no doubt about that. And what concerns me is that we're taking away the ability of employers to create a safe workspace. I understand people saying we don't want government top-down mandates, but really I have concerns about anyone saying that an employer can't do what they feel they need to do to keep their workers safe. And I honestly hope we don't see more of this across the country, because I thought that was kind of threading the needle, saying, okay, we're going to let workplaces help come up with policies to get people vaccinated and to promote safety. And here's one more final point. From an equity point of view, if you're going to have a mandate, I hope people are putting in a healthy dose of education, because we know that African Americans have a lot of concerns today. A lot of talk about Henrietta Lacks and her family. We know that women have concerns about fertility, even though these vaccines have been proven not to affect your fertility, particularly not as much as the COVID virus does. And so I hope that there's education and compassion that comes along with these mandates. But again, these mandates work. They help keep us and our community safe and open.
And lastly, scientists seem to be under attack right now when it comes to, putting the science behind their findings and answering questions. Where do you stand on this? I know I saw you having this conversation as well. Being a scientist in 2021 is very different than maybe in the past.
Oh my gosh, it so much is, because when you say anything, it's put into a political box. And I always try to extract myself from politics. You saw I did it earlier. I said, look, here's what the science says. And I think it's important as scientists, as doctors, that we try to keep ourselves out of politics. But I also think it's equally important that politicians let the experts make health decisions, give them the power, the space, the ability to be able to talk to their patients. And in this case, your patients may be the state of Indiana or the entire United States, and tell them what we know the science shows us versus what people want to use as a political tool to divide us.
Dr. Adams, I always enjoyed speaking with you and just getting your perspective. You've been in many rooms that many of us haven't had a chance to be in. So thank you so much for joining us.
Thank you. Thank you. And again, get the facts, and hopefully you'll make the decision to get your vax.